Good morning, Dr. Calhoun. Welcome to Lisbon. Dr. Calhoun is from the College of Obstetricians and Gynecologists. He's specialized in maternal-fetal medicine, and is been studying for a long time, for a long period of time, and lots of studies about the relation between previous induced abortion and later preterm birth. So, can you tell us what's your concern in this field?
Well, I think the key issue is that there is definite linkage between previous abortions and preterm birth, and in the studies that I've looked at, now some 60 in the world's literature, is that the risk is as high as 30 to upwards of several 100% risk increase for a preterm birth following a first abortion. And when that happens, of course, the families are devastated. And the sequelae with cerebral palsy and developmental delays and the cost to those hospitalizations are just enormous to society and to the families.
And can you tell us about the relation between several abortions, and does it increase the risk, or?
Yes, and that's a very good question, because a lot of things in science would like to see an effect for the exposure to the particular risk factor. And in fact, if you look at the literature, again, throughout the world, the more abortions you have, in other words, 1 or 2 or 3, the higher the risk for a subsequent preterm birth.
And it's for all ages of preterm, or do you find that there's a relation between the induced abortion and the smaller babies?
Well, that's another very good question. If you look at the literature and carefully separate it out, the babies that are less than 28 weeks or 1,500 grams, that group of patients seems to have a much higher risk of having had a preterm, having an abortion for their preterm delivery, and it's lesser between 28 and 32 weeks, but still significant. But that's an excellent point. It is much higher risk to have a baby very prematurely in delivering.
And we know that in Europe, the studies from 2000 and 2007, the studies for cerebral palsy in this group of babies, less than 1,500 grams, are heavy in cerebral palsy. They're about 40 times higher. Do you find that in the U.S.?
Absolutely. The risk when you get under 1,500 grams goes up to, like you said, 38 to 40 times. Normal rate's about 1 in 1,000 at term, so 38 times is a massive increase in those babies.
Can you tell us what's the burden economically and family-wise, the burden of a very preterm baby with all its the concern that and all the pathology that it's associated with it?
We just actually got a published study in the Journal of Reproductive Medicine that just came out actually in October of this year, 2007, and addressed that specific issue. And all we looked at was initial hospitalization. So in other words, if you delivered a baby at a certain gestational age, we looked at that cost. And in my nation, it's $1.3 billion a year for preterm deliveries associated with abortion. Now, that doesn't include all of the other expenses that these children have going forward in school for developmental delay, and also the occupational physical therapies, home oxygen therapy, and all the cost to the women in terms of the emotional damage that's done with abortion. So this is just a very small part of the cost.
And do you find that with the medical abortion it will have an influence on, will you find a similar connection, or you don't know yet?
Well, there's not enough data to really support it. There was one smaller study that was done earlier this year that talked about medical abortion being no worse than surgical abortion. This is not very reassuring, but there's not enough data yet. I think it's going to be the same, because abortions take a natural process, interrupt it, and then cause the problems that they cause.
So the point is an artificial disruption of a pregnancy. That's the great point for the future of that woman.
I think absolutely, and we believe that interruption and artificial ending of that pregnancy in that baby's life is related to the infection that's set up, and also the unnaturalness of that process. You damage the cervix by dilating it and forcibly entering the uterus, and the medical side isn't going to solve that. You still have to dilate a normal pregnancy and do the same things.
Do you find that something you've got to say to a woman that's considering doing an abortion?
Oh, absolutely. In the United States, in fact, there's several states have put it on their informed consent documents, and actually abortion has been, by the American Institute of Health and Medicine, actually last year, buried it in a huge 500-page tome on preterm birth, but they actually acknowledged that abortion was a risk factor for preterm delivery finally after many years. And I tell all my patients, if they're considering abortion, that what they need to know. Plus, in my group of patients who are very high risk, everybody who has had preterm deliveries, almost all of them have had abortions previously. So I treat them very aggressively and much different than a normal patient.
Thank you very much.
Thank you.
Well, thanks a lot. I appreciate it.